So I'm Katherine. I am a outgoing DPhil. So my work looks at understanding how and why networks change practices to improve service delivery and quality of care. So health systems are complex systems with complex problems and many function suboptimally, leading to poor quality of care, service delivery, and clinical outcomes. One approach to try and solve these problems are networks. And for my DPhil, I consider networks to be groups of facilities or stakeholders that are linked informally or formally, horizontally or vertically through different initiatives, activities, interventions that aim to change practices to improve care and health system functioning. These are across levels and sectors of care and geographies, and they're within the health system, not something that's parallel set up. So why did I think this was worth spending 4 years thinking about? Much of the existing literature is focused on kind of clinical results of networks or their effectiveness, but not how and why they actually work to achieve those results. The literature says that there seems to be something fundamentally important about harnessing collective effort via networks. And it's an approach that has increasing interest in many different countries. And so could hopefully inform future adoption of networks. So my DPhil had 3 different phases: a scoping review where I mapped the literature and developed a framework that outlined the main components of a network and mapped the uses, purposes, and stakeholders. Then I did a realist review that developed a program theory based on the literature to explain how and why networks form and function to be able to change practices. And then I tested this theory in a realist evaluation on the NEST 360 program in Kenya to refine the theory and pull out transferable learnings. So my program theory says that a network evolves across 3 different phases: initiation and formation, functioning, performing, and sustaining change and impact. And to do this, there's a set of processes, activities, foundations, and cross-cutting factors. And so a network starts with an identification of a problem, developing a collective vision linked to that problem, taking action, and developing a network identity and culture. And these processes continue to manifest in different ways throughout the evolution of a network. There's different activities like cross-learning, resources, leadership, adaptability that help the network achieve its results. And then this is kind of underlined by a foundation of these very relational elements of teamwork, psychological safety, commitment, empowerment, and most importantly, purposeful relationships, linkages, and partnerships. And then there's communication, trust, energy, effort, and passion that help all of this happen.